Are you desperate to heal from your trauma and remove all your triggers? Well, I've got you. My name's Rebecca P. Fox. I'm a psychotherapist and I want to welcome you to my channel today. I'm going to talk you through 5 clear and easy to understand tips for survivors of trauma. And I'm going to include insights from my perspective as a psychotherapist, which will focus primarily on how trauma can be rewired using a neuro change method that works on someone's neuroplasticity. So let's get into this. Number 1, seek professional support. Find someone who specialises in healing from trauma. I cannot emphasise this enough. Look for a therapist or a counsellor who is confident in this field and is capable of working with someone who has experienced trauma. Because what you need to understand is that trauma specialists, they have specific training and experience when it comes to working with and helping individuals heal from traumatic experiences. So these really will be the best people who can help you heal from trauma. If you want to get fast, effective results, you need to find someone that specializes in that field. There are so many different approaches that are available for trauma, such as trauma-focused talking therapy. You also have eye movement, desensitization, and reprocessing, also known as EMDR, cognitive behavioral therapy, CBT, and dialectical behavioural therapy, DBT. These all have a place when it comes to addressing trauma-related symptoms, so it is important that you do your homework and find someone who you feel confident in and who has the best method for you when it comes to healing your trauma. Also, be sure to look up their reviews from previous clients who've worked with them. Don't be afraid to ask them for this information, as most therapists, they have a website, and these websites will show reviews from previous clients. Medication in some cases may be prescribed by a psychiatrist, and these will be done to manage your symptoms like anxiety or depression. And there is nothing wrong with taking medication for symptoms that you're struggling with, but it is crucial to work closely with a healthcare provider to determine if this is appropriate for you and if they've given you the right medication, as there are many different types available and it's finding the right one for you. Number 2, understanding neuroplasticity. Educating yourself about neuroplasticity will provide you with motivation and hope for recovery. Once you have an understanding around how the brain can adapt, rewiring your brain with the Neuro Change Method works on 4 core principles. Number 1, mindfulness practices. Engaging in mindfulness meditation or body scanning exercises allows you to become more aware of your thoughts and your sensations. And by doing so, you can begin to change trauma patterns and processes. Number 2, cognitive behavioral therapy, CBT. This is a widely used therapeutic approach that many CBT practitioners will use as a way to deal with mental health issues. And this is because CBT can be applied and used to change negative thought patterns. Once a therapist can help you identify these issues, they can then reframe unhelpful beliefs and behaviors. Number 3, brain training games. Some apps and programs are designed to improve cognitive functions and memory. These are so beneficial for enhancing neuroplasticity and cognitive flexibility. Number 4, consistency. Repetition is essential for neuroplasticity. The more you engage in these exercises and techniques, the quicker you are to rewire your brain over time. Number 3 is the mind-body connection. Trauma can be stored in the body through a complex interplay of physiological, psychological, and neurological mechanisms. And this is often referred to as somatic memory or body memory. Understanding how trauma is stored in the body can shed light on the physical and emotional symptoms that are experienced by trauma survivors. And I'm going to run you through a general overview of this process using a bullet point structure. Fight, flight, or freeze response. When a person experiences a traumatic event, the body's natural stress response system, known as the fight, flight, or freeze response, is activated. During this response, the body releases stress stress hormones like adrenaline and cortisol to prepare for immediate action. Physiological changes. Traumatic experiences trigger significant physiological changes such as high heart rate and high blood pressure. Often people will get muscle tension, and the body redirects resources to deal with that perceived threat. These physiological changes are adaptive in the short term, but they can become maladaptive when trauma is severe or ongoing. Neurological imprinting. The brain plays a key role in storing traumatic memories. The amygdala is a region in the brain which is responsible for processing emotions. And what it does is it tags traumatic events as highly significant. And this can lead to intense emotional reactions when similar situations or triggers are encountered, because your amygdala recognizes that it's going to be an issue and you're no longer safe. Sensory and emotional memories. Trauma memories can be encoded not only as verbal or visual memories, but also as sensory and emotional memories. This means that traumatic events are stored as physical sensations like pain, tension, even numbness. And the emotions are often experienced as anger or fear or even helplessness, sending that person into an emotional dysregulated frenzy. Dysregulation of the nervous system. Trauma can dysregulate the nervous system, leading to chronic hyperarousal, which is an overactive stress response. Or we can have the opposite, which is hypoarousal, and this is when someone shuts down. These can manifest in physical symptoms such as muscle tension, digestive issues, so lots of stomach problems, headaches, and sleep disturbances is very, very common. Somatic symptoms. Trauma survivors may experience a range of somatic symptoms, and what I'm talking about here are physical manifestations of the stored trauma that they had experienced. So the kind of symptoms that are shown are chronic pain, lots of tension. They often have autoimmune system disorders, and it's important to note that what tends to happen is these physical symptoms can have no apparent medical cause, and what often happens is they get labelled as psychosomatic. Triggers and flashbacks. Certain sensory cues, situations, or emotional experiences can serve as triggers. And what this does is it causes the stored trauma to resurface. And this can lead to emotional and physical reactions that feel as though the individual is reliving that traumatic event. And what we call these are flashbacks. Body memory. The body, believe it or not, can remember. And trauma in the body comes in the form of chronic tension, pain, and other physical sensations. These sensations are often experienced as a constant background presence, even when there's no immediate threat. So that person tends to feel constantly on edge. They'll have a high degree of anxiety for the majority of their life. Disassociation. Some trauma survivors may experience a disconnection from their body or emotions, and this can serve as a coping mechanism to protect them against the overwhelming distress that is associated with the trauma that they experienced. So, what practices work to help with the mind-body connection? Let's look at those. The first is yoga and Tai Chi. These practices really do help you connect with your body. They help you release tension. They help you regulate your nervous system. And it's these practices that promote physical and mental relaxation, which is valuable as part of your healing journey. And also, great breathing exercises are a way to calm your nervous system. When you learn to practice deep belly breathing, this is what taps into your nervous system. And it's a very simple yet effective technique when it comes to managing stress and anxiety. Number 5, build a support network. I want you to find safe spaces. I want you to surround yourself with people who make you feel safe, that make you feel understood. This could be close friends, this could be family members, or even support groups for trauma survivors. And it is important that you communicate openly, discussing your needs and your feelings with your support network. They can provide you with an emotional level of support that you will need. They will give you encouragement that's going to help you move through this process, and ultimately you're going to get a sense of belonging, which when you've experienced trauma, you can feel like you're very much alone in this. Another thing I want you to bring into this is boundary setting. Setting and maintaining healthy boundaries with people who are not supportive is crucial to your recovery. What I want you to do is prioritize your well-being. So limit your exposure to potentially triggering situations or people is gonna be important when it comes to accelerating your healing process. I want you to remember that healing from trauma is a journey that does take time, and progress may not always be linear, especially when you're trying to do this on your own. So be patient with yourself and trust the process. Everyone's experience and needs are very unique. So if you want to know more about my rewiring method, the Neuro Change Method, and want a personalized plan which is tailored to your specific situation and needs, be sure to get in touch. And if you know anyone who needs to hear this, please share.